I'm Mangino. Welcome to the Mangino Talks Pittsburgh podcast. We talk about everything that matters to us all, from current events to Pittsburgh history, social issues to sports, politics to practical day-to-day life. And it doesn't get more practical day-to-day than what we're going to talk about in this episode. It's about seniors. It's about the care that they are receiving, especially at the state level. The concerns regarding funding, just not where it needs to be to make sure that they all get the care that they desperately need, and I would argue deserve. I mean, we only get to have what we have today because of what the seniors were able to build during their lifetimes in communities and everything else. So I think we owe it to them to provide them the very best of comfortable care and the medical care that goes along with it. But the finances just are not there. There's a lack of commitment from lawmakers, especially at the state level, to make this happen. And we're going to be welcoming my guest, Zachary Schamberg, President and CEO of the Pennsylvania Healthcare Association, more available at PHCA.org. But I want to thank you now for listening to the show. Make sure you click the subscribe button so you don't miss an episode. For more on me and the show, make sure you visit ManginoTalks.com, and you can follow me on your favorite social media platform by using @ManginoTalks. And then once you find me, please like, follow, subscribe, and share the pages with your friends and your family. Let's welcome Zachary Schamberg to the program. Zach, welcome to Mangino Talks. Good to have you on.
Mangino, thanks for having me. And I don't think I could have put the issue more eloquently or more succinctly than you just did. So thank you.
Absolutely. This is a critical thing that we need to be addressing here across the Commonwealth. The idea that we are not properly caring for our aging loved ones in a whole multitude of different ways, whether it's in absolute nursing care facilities with skilled care or even assisted living facilities and others as well, personal care. It just seems as though we are dropping the ball economically at every level. And we've talked on the radio countless times about the genuine concern that we have about facilities that are not going to be able to continue on because of this great disparity between what it costs to provide care and then what's being reimbursed at the state level. Talk about that, please.
Yeah, that's exactly right. And unfortunately, in Pennsylvania, we've kicked the can down the road. We haven't made our senior citizens, our aging population, a priority in Pennsylvania. And that's especially prevalent today because you have to look at our aging population across the Commonwealth. Our fastest growing demographic is age 85 and older. That same population is set to nearly double by the year 2030. And we are in the midst of the baby boomers aging into the demographic most in need of long-term care. So you can say, we'll put this issue aside, we'll address it next year. We can't do that anymore, Mangino. The clock has run out. We've got to invest in long-term care today to ensure that we can care for our seniors, not just today or tomorrow, but in the years to come. And you said it, the uncertainty surrounding long-term care is something that we've sounded the alarm on throughout the last few years, throughout the COVID-19 pandemic, but it's something that every Pennsylvanian should know. There is extreme volatility in the long-term care marketplace. There are facilities selling. There are facilities going through operational challenges and reorganizing. And unfortunately, there are nursing homes and there are personal care homes and assisted living communities out there in our state that have been forced to close their doors, whether it's closing their doors to new admissions and not accepting new residents, or simply shutting down altogether because it is not financially viable. It is not financially feasible anymore. And that is something that we should all be concerned about today, tomorrow, and in the years to come.
Zach, talk about the funding disparity specifically, if we could, especially when it comes to non-Medicaid provided care. My understanding is that it can be to the level of hundreds of dollars a day to the care that's provided to what's being reimbursed from the state.
Yeah, that's exactly right. And we've seen the numbers shift over the years. 30 to 40 years ago, more folks were going to skilled nursing using private pay, using their own funds.
Mm-hmm.
They were using or utilizing the federal Medicare program. They were utilizing a long-term care insurance product that helped pay for their care. And Gina, those days are over. And that has been shifted or turned upside down where Medicaid, the state's Medicaid program, is the number one payer for long-term care and skilled nursing care in a nursing home, to be more specific. The problem is, as you outlined once again, that reimbursement does not keep pace with the true cost of care, and it has not kept pace with rising costs. In other words, there is a shortfall and there is a disparity. So what does a long-term care provider do? They have to cut. They have to let go of staff. They can't accept new residents. They can't invest in the care that they provide. They can't invest in technology, facility upgrades.
Mm-hmm.
Really, it handicaps the entire system from moving forward and providing the best possible care that we can and the best possible care that we should. If Pennsylvania doesn't prioritize Medicaid reimbursement for nursing homes,
Mm-hmm.
then we are not going to make this a sustainable or a viable system moving forward.
Zach, lawmakers are patting themselves on the back. A couple of years ago, they increased the funding by, what was it, $30, $40 a day, and they think that they've made some real impacts as a result of that. My understanding is that it may make for a great news release and a news conference, but it really doesn't change the dynamics practically at all for those that are providing this care, especially those that are nonprofits that are just trying to figure out ways of existing at this point, and they provide so much benevolent care on top of what they are otherwise compensated.
Well, first of all, look, forget for-profit and not-for-profit. The average operating margin for nursing homes in Pennsylvania today is negative 8.2%.
Hold on a second. What do you mean negative 8.2?
That's the average operating margin for nursing home providers in Pennsylvania today. So think about if you're a small business, think about if you're any kind of business in any kind of industry. How do you make that work? And for nursing homes, how do you continue hiring staff as wages are going up? And how do you continue your mission of providing care? Look, last year's investment was historic. It was long awaited and it was much needed. But the key part to remember about all of this was that was commensurate funding with a new staffing minimum increase. That helped providers achieve new staffing minimums and, for the first time in Pennsylvania, staffing ratios. Not only that, Mangino, we worked with Governor Tom Wolf, we worked with legislative leaders, we worked with the workers' unions and other stakeholders to introduce accountability provisions for providers to ensure that funding went where it's needed most, to residents, to the resident bedside, and to workers. But that historic achievement and investment only gets us to year one. And our plea to members of the legislature and our plea to Governor Josh Shapiro is that we need sustainability in long-term care. We must ensure that we can keep our doors open and continue providing care in the years to come. A one-time investment doesn't solve that issue. We need continued investment to ensure sustainability.
I understand that you are getting a lot of contacts regarding a facility closure in Johnstown. What can you tell us about that facility and what that may be emblematic of moving forward?
Yeah, and that's been very, very interesting because it's not a nursing home. It's a personal care home. It's called the Atrium. As you mentioned, it's located in Johnstown. It takes specifically SSI or private pay, and they have come to the realization that given the SSI reimbursement level, given that new residents are coming to them without personal funds, as maybe we saw 20 or 30 years ago, they do not have a financial viable path forward. And so they came to the conclusion that they have to shut their doors. And unfortunately, Mangino, as I started our conversation with this, we are getting to the point where we're going to see this more and more. And if it's not closing doors to new admissions, it's closing doors altogether because we have not made this a viable industry for the years to come.
The wages that are being paid, my understanding is that the wages for the care at these facilities is growing at a pretty good clip at this point. No problem with the idea of people getting proper wages for the work that they're doing. But again, it's making it difficult to be able to provide the care with the limited resources that are available. And you have this concern that once you have staffing requirements, it even makes it exponentially worse.
Yeah, that's exactly right. And to be clear, we've always had staffing requirements, but last year, and in fact, July 1st of this year was the first time in the last 30 years that we saw that staffing minimum level go up. And we saw the introduction of staffing ratios for nursing homes. We have providers from Western Pennsylvania tell us that from the start of the pandemic till today, their wages have gone up about 30%.
Hmm.
So again, when you look at what was done last year, a 17.5% increase, that takes a big chunk out of that increase, but it doesn't get providers where they need to be. And
Right.
as you said, Mangino, these are frontline caregiver roles. These are careers of compassion. These men and women should be paid more and more and more each year. But when we have a system in which we are so reliant on state dollars and Medicaid dollars that don't keep pace, what are providers to do? We've got to make the investment on the front end from the state so that providers can make the investment in their caregivers.
Is there a role that is being played in the limitations in migrants, legal migrants coming to the states, coming to Pennsylvania to be able to work in these roles? The reason why I bring this up is that anecdotally, with the loved ones that I've had in care facilities, there have been a number prior to COVID that were immigrants, first generation here, and they saw it as a way of taking care of their families that weren't here. Mom and dad, grandma and grandpa back in the old country, they were caring for them here. And I'm wondering, because of COVID, because of maybe some of our federal policies, has that played any role in being able to attract the people to work in these facilities? Because my understanding is that this is yet another one of those jobs that unless you have that calling for it, Americans are not inclined to want to do this most times. Your thoughts about that?
It's such a fantastic point and such a terrific question. In the midst of the pandemic in 2021, we advocated for and saw legislation pass here in Harrisburg that entered Pennsylvania into what's called the NLC, the Nursing Licensure Compact. And essentially what it allows is for Pennsylvania providers to hire nurses from other compact states. So if we can't find folks in Pennsylvania, we can look to 30 plus other states to hire a nurse, including our neighboring states. That's step one. But you said it, Mangino, if we can't find caregivers in Pennsylvania and we can't find caregivers in the United States, doesn't it make all the sense in the world that we would look to the rest of the world to find those caregivers? Right now, we have members in Western Pennsylvania who are recruiting nurses from the Philippines. We have members from Southeast Pennsylvania who are recruiting nurses from other countries. However, it must be said, we do not have comprehensive immigration reform in this country. We need it. The Biden administration, for whatever reason, stopped allowing green cards or worker visas in for nurses. They shut the program down earlier this year. We can't figure it out. Nobody can figure out why they made this move. So at the same time we are facing a workforce and a caregiver crisis, we are putting up every barricade possible to finding those prospective caregivers. Something needs to be done. We're talking to our Pennsylvania congressional delegation about this. We're working with our federal partners to fix this. Something's got to be done when it comes to immigration reform.
Can you explain a little bit for us regarding the different categories of care? There's assisted living, there's personal care, there's skilled nursing facilities that are available as well, maybe others that I'm not even thinking about off the top of my head. And what differentiates them and the funding that can come in as a result?
Sure. Yeah, it's really the level of care that differentiates. Typically, nursing homes or skilled nursing facilities are 24/7 around the clock care. You take a step down and you go to assisted living. This is help with activities of daily living or ADLs, passing medication, things of that nature.
Hmm.
And it's typically in a facility or in a building. And then you get to personal care, which is help from an aide 1, 2, or 3 days a week, but very minimal help. You also have parts of the healthcare continuum and the long-term care continuum, such as home care, which is in-home care, where an aide will come and take care of someone every day or throughout the week. At PHCA, we represent nursing homes, personal care, and assisted living. And one of the key differentials between the three is, as you mentioned, funding. Medicaid is solely responsible for paying nursing home care in Pennsylvania, but unfortunately, right now, we do not allow Medicaid to pay for assisted living care or personal care in a personal care home. That's something that we're trying to fix at the state level. And we've supported legislation that is moving through the state Senate that would potentially allow Medicaid or would allow assisted living to become Medicaid eligible. That would be a big step forward in Pennsylvania so that we're not solely relying on personal funds, we're not relying on SSI, and we're allowing folks to stay in the best possible care setting for them.
What about the argument that the funds just aren't there? I'm sure you've heard that from politicians in Harrisburg. What's your retort to that?
It's about prioritization. And we have a $45 billion state budget this year. It's about allocating dollars to where they're needed most. And thus far, the entire debate has been around education funding. Education funding is certainly important, and we're thinking about our future generations. What about our greatest generation? What about our older generations? What about our fastest growing demographic?
Yes.
If we're looking down the road at the next 5 to 10 years and we're looking at our priorities, long-term care has got to be a priority.
When you talk about individuals that are in home care, to what extent has the COVID pandemic played a role in diminishing the number of seniors that are going to facilities and then aging in place, if you will, with their adult children and maybe even grandchildren, and the impact on care facilities all over the state?
We saw occupancy levels drop at the height of the pandemic simply because folks wanted to take care of their parents or grandparents at home.
Mm-hmm.
But those occupancy levels have gone back up as we're entering out of the pandemic. And look, home care is terrific for those who can be cared for at home. I would encourage you, and I would encourage your listeners, to visit a nursing home and to walk the halls of a nursing home and tell you or tell me if those folks can be cared for at home. Not everybody's got the familial support system.
Right.
Not everybody's got a house or apartment that lends itself to home care. At the end of the day, nursing homes are the safety net. They're the backbone of our long-term care system, of our healthcare continuum. And if that fails, it would be catastrophic for the rest of the continuum and the rest of the system.
As you talk about the demographics, 85 plus, the fastest growing in the Commonwealth, how concerned are you about the issue of dementia care, Alzheimer's, different aspects of dementia, and that heightened level of care? It's one thing if you're dealing with an individual that has physical limitations as they grow older, but then those mental limitations, they can cause even greater demands on a system, can't they?
Yeah, that's exactly right. And we've seen, not just with our aging population, but to your point, that explosion in terms of our dementia population, those with dementia, those with Alzheimer's. And Mangino, on a personal note, this is something that we just went through with my grandfather. And he spent the height of the pandemic in a nursing home, in personal care, came home for his care. But we saw it as someone living with dementia at the height of the pandemic in a facility. Are we prepared for that population, for that increasing population? Are we prepared in terms of training? Are we prepared in what their needs will be? Do we have enough secure dementia units within these facilities that we need? The answer is no on all accounts, on all fronts. So we need to make this, once again, a priority moving forward so that we can care not just for our aging population, but especially those with Alzheimer's and with dementia, to ensure that we're caring for them properly and that we're prepared.
You mentioned legislation in Harrisburg that you are hopeful regarding the providing Medicaid for assisted living communities and some personal care homes as well. Their ability, I guess, to convert to assisted living communities. What can people who are listening right now do to make a difference? So one of the things that I really want to accomplish on this podcast is not just letting people know about what's going on and then getting people worked up about what's going on, but giving them a role that they can play in making a difference and making things better once they observe that there's a problem that needs to be addressed.
Yeah, of course. And we appreciate the opportunity. This is something that we share with our members and with members of the general public all the time. The most important thing that you can do if you're concerned about a loved one in long-term care, or if you think you will one day have a loved one in long-term care, is contact your lawmaker. And the message is fairly simple. Make long-term care a priority today, whether it's supporting and advancing Senate Bill 520, which is the bill that would allow for Medicaid and assisted living, whether it's telling lawmakers we needed a complete state budget that invests in long-term care. The most important thing you can do is reach out to your state representative and your state senator, send them an email, make a phone call, meet with them in their district office or here in Harrisburg, and tell them that long-term care must be a priority moving forward.
The odds are that the older people are able to survive, the more likely it is that individuals will end up at some aspect of a care facility. I mean, we don't have the families that we once did. My grandparents, they had 5 kids apiece on both my mom's side and my dad's side, but then my mother and my father had 2 kids, and now I have 1. There just isn't that resource available to be able to provide the care to those who are getting older from their children and grandchildren. So I'm guessing the likelihood is that there's a growing number of us that are going to end up in the position of needing some aspect of care.
That's exactly right. We're seeing a growing reliance today on these services, again, at a time when our elderly population is rapidly increasing. We have to fund care. We need to make sure that we've got sufficient workforce to provide care. And again, Mangino, not just today or tomorrow, but in the next 5 to 10 years. And what concerns us the most is when we see a facility like the Atrium close its doors, like Fox Subacute at Warrington, a facility dedicated to patients on ventilators, closed its doors last year.
Wow.
If that's occurring now, and it's not forcing the state to invest, what does this look like over the next few years? It's scary to think, but it doesn't mean that we can't fix the problem today.
Zach, I'm concerned that politicians only really do something that matters when we're in a crisis mode. Like, they don't get the budget dealt with on time. They wait, and they get to the point to where they feel as though there's the political pressure to absolutely have to. How close do you believe that we are to a true crisis where we have not only an institution here or there that closes, but the real risk of having them closing down across the Commonwealth in order to tragically grab politicians by the collar and demand their attention to this issue?
We've been in crisis in long-term care since March 2020, since the start of the pandemic. We saw the height of the pandemic, and then we saw its after effects beginning really in January 2021. We started to see facilities announce they would be closing their doors. We started to see backlogs in hospital waiting rooms. We started to see the entire healthcare continuum enter into a jeopardized state because of what was happening with our nursing homes, with our personal care homes, and with our assisted living communities. We are in a funding crisis. We're in a workforce crisis. We're in an access to care crisis when in one of the oldest states in the entire country, we can't ensure that we will care for our aging population. That is a crisis management,
Wow.
Plain and simple. So now is the time to act. And if we don't, we will have a real challenge ahead of us.
Zachary Schamberg, he's the president and CEO of the Pennsylvania Healthcare Association. More available at phca.org. Zach, thank you very much for your time. Do appreciate it.
Mangino, thank you as always.
Thank you. And thank you for listening to the Mangino Talks podcast. Please be sure to click the subscribe button so you don't miss an episode. New episodes drop Monday through Friday at 3 p.m. Pittsburgh time. For more on me and the show, make sure you visit manginotalks.com. If there's a topic that you would like me to talk about or a guest that you would like me to have on, send me an email, mangino@manginotalks.com. Follow me on your favorite social media platform by using @ManginoTalks. And then once you find me, like, follow, subscribe, and share the pages with your friends and your family. And thanks again for listening to the Mangino Talks Pittsburgh podcast.